Do you suffer with neck stiffness and it's difficult to check your blind spot while you're driving, or you just find that you're limited when you're trying to look over your shoulder? You're not sure exactly what's going on and what it is that you can do about it? Well, this is what we're going to be discussing today, is how you can help your neck at home to move better, to decrease that stiffness and pain. Now, before we start, it is really important that if you are having any numbness and tingling that goes into your arms or down into your hands, this exercise is probably not the best for you. You need to consult with a local professional to make sure that you're getting the care that's more specific to your needs. Whenever we're dealing with nerve issues, that is a different story, and you need a specific prescription that's recommended for you. So if you're still with me, then I'm assuming that you do have some stiffness in your neck, that you notice it's difficult to turn and check your blind spot, or maybe you even get a little bit of pain when you're trying to do any kind of rotation or when you're trying to look up or anything like that. That's what we're going to be discussing today, and we call that mechanical neck pain. So it's pain that you have when you're trying to move, or a mechanical motion. Now, a lot of people want to know what started this mechanical joint pain in the first place. And there's a lot of things that it can be. It can be, one, that the joint's simply not moving correctly, which can happen because the muscles may be tight, the ligaments may get pinched, and that joint is simply not able to move correctly anymore, or it's kind of forgotten how to move correctly. And that can happen with a really sudden injury or fall. Now, you may have more of an arthritis type pain that has come on slowly over time, and that has decreased the motion in your neck. If that's you, you may also have some deep achy pain that goes along with that, and you may feel like the muscles are really sore and tight. But if you have mechanical pain, you'd probably have a limited range of motion or decreased ability to turn and look over one shoulder or the other, or both. You probably have some muscle stiffness because those muscles haven't been able to move through their normal range of motion, so they're tightening up. And you probably feel like there's a stuck joint, or you feel like it just stops. And that's actually how we know it's a mechanical problem or a joint problem, as opposed to a true muscle problem. If it's a muscle problem, you most likely will be like, I can get there, but it hurts. A mechanical joint problem is actually, I get to this point and I can't go any further. And that's specifically what we're going to be working on today. And the motion that we're going to be working on today is actually rotation. The reason why we start working on rotation is because that's the most natural motion for the joints, specifically the facet joints. So the vertebrae have a facet joint on each side. The top vertebrae has ones on the bottom vertebrae has ones on the top, and these intersect or connect. And rotation is what actually helps to bring some healing to that joint. So most people have a limitation in rotation, but also rotation is the most important motion to be able to do. So that's why we're going to work on that today. It's really important to also note that rotation starts from the top down. So you have 7 cervical vertebrae. So the first couple of joints, the C1 and C2, are responsible for about half of your neck motion, specifically in rotation. The other thing to note is that the upper thoracic vertebrae, or T1 through T3, so that's lower down and where your ribs attach, is also responsible for some of your rotation. Now, that's more the end range of rotation. So many people who come in to be clients don't understand why I'm working on the upper back when they have a problem with their neck, but it's because the upper back helps do those last degrees of rotation, and we need it to be able to move our neck correctly. Now, why is that important for you? Because you want to figure out which joint it is that's actually causing your limitation or you're stuck in order to do the next stretches and exercises we're going to talk about. So the first thing we want to do is actually to help that neck start moving into that rotation. Now, you want to use either a hand towel or a pillowcase for this. I prefer the hand towel because I feel like it gets a little bit of a stiffer edge. However, I will tell you that I instructed a patient in how to do this exercise with a hand towel that had a very firm edge once. He ended up doing it so forcefully that he actually cut through his skin. So if you're someone who tends to think that if you do a little bit, it's good, if you do more, it's better, then I'm going to have you go ahead and stick with the pillowcase because that's less likely to hurt you. I'm going to show you with a hand towel, but you can use a pillowcase too. So you're going to take the hand towel, you're going to put it over your shoulders, and then you're going to kind of put it at the back of your head and come down until you get off of your skull, but you're on the cervical vertebrae. So you should feel this on your neck. Now, notice that I'm still kind of covering my chin here. So this would be close to that level of C1 or C2. What you're going to do now, we're going to say that I have difficulty with left rotation. So what you're going to do is you're going to hold this left hand, and then you're going to pull forward with that right hand. Now, if you're like, okay, I can do this and I don't feel like it's doing anything or it's helping me, then what you're going to do is you're actually going to cross your arms. So you're going to take your right hand to hold this one down, and you're going to take your left hand to pull up. So if you have more motion, you may need a little bit more aggressive of a stretch, and this will help to get you a little bit more stretch. Now, if you're able to do this one and you're feeling like this is not the right level for me, then you can slide it down and get to more of your mid-neck and do the same exercise. So, right hand is holding the left side down, left hand is pulling up in kind of a diagonal pattern. And at that point, you should be able to get to that point of feeling that joint moving and getting you a little bit more rotation. Now, the goal with this one is not to hold that position, it's to move through it. So you want to do 10 repetitions, allowing your head to move actively as far as possible, using the towel to help get you a little bit more motion, but staying pain-free the entire time. It's really important that we stay pain-free because we don't want to cause any joint compression, which will lead to muscle aggravation and increase in pain. The whole reason why we're doing this is to decrease pain, not to increase pain. Now, if you feel like that doesn't even get the right level for me, you might need to go a little bit further down. Now, when I need to go further down, I do actually like to use the pillowcase more because I feel like it's a little bit longer and a little bit easier to use. So I've got my pillowcase on my lower neck, upper back area. I'm going to take my right hand, and this time I'm really going to firmly hold down on that left side of the pillowcase while I lift up the right side. You want to make sure you have a really firm grasp because you're really going to be getting that end range of motion, and it's going to require a little bit more leverage than the beginning range of motion did. So you're going to look as far as you can actively and then provide that stretch to increase that motion. And again, we're not holding into that stretch, we're just moving into it and out of it. Again, you're going to do about 10 reps. After that, we'll go ahead and do a stretch to the muscle, and you can do this at the upper levels as well, either using the towel or the pillowcase based on the level that you found was most difficult. Now that you've got the joint moving better, we're actually going to stretch that muscle, which means we're going to do a bit of a hold. But again, it's important that you get the joint moving first. So you want to do 2 sets of 10 reps to get that joint moving, and then we can stretch the muscle on top of it. If we start trying to stretch the muscle without the joint moving, things are not going to go well. So make sure you got that joint moving first. Now, to do that stretch, it's going to be the same type of motion. We're just going to do a hold at the end when we get into that stretch position. So again, right hand is pulling down on left side of the pillowcase very firmly. Left hand is coming across. I'm going to actively move. I've already got that motion, so it's feeling good. Now I'm going to pull a little bit more on that pillowcase, which is going to stretch that muscle a little bit. I'm going to hold it for 10 seconds and then release. For this one, you are going to do that 10-second hold, but we're only going to do 3 reps. Now, a lot of times people will ask me, should I go ahead and do it in both directions? I feel like if you have stiffness on one side, there's no problem with stretching the other side as well. But I would make sure that you do the joint mobilization, then you do the stretch, then you do the same thing on the other side. You will definitely notice that it probably doesn't feel as stiff and as tight. You may feel like I'm not getting as much bang for my buck on the pain-free side, and that's totally fine. It's just important to make sure that we're keeping everything nice and equal. Okay, so now that your neck is actually rotating better, you've got the joint mobilized, you've got the tissue stretched, I like to go ahead and work through the upper traps. So these muscles are huge and they start from the neck and go down into the shoulder. So anytime I'm doing any work on my patients or on myself to my neck, I like to go ahead and stretch the upper traps afterwards. Now there's multiple ways that you can do this, and I'm going to show you many different forms, but the whole goal is that you feel a stretch through this upper neck. We'll do some different progressions, but I want you to find the one that works best for you. So the simplest one is to put your arm down to the side, making sure that you're in a good position. Your head is over your shoulders are over your hips. Your arm is just down to the side, just kind of dangling, and then you're going to bring your left ear, in this case, towards your left shoulder. This is a simple stretch for the upper traps, and for some people, this is enough. With any stretch, you're going to hold it for 10 seconds before returning to neutral. You want to wait 10 seconds before you do another rep, and I usually recommend 3 reps. Now, if you feel like that's not enough stretch for me, what I'm going to have you do is put your arm out at about 30-degree angle. You're going to kind of reach out through that arm, so you should feel a little bit of a stretch even in your arm at this point. And then you're going to do the same motion. You're going to bring your left ear down towards your left shoulder. Now that will probably feel like a really good stretch. You're going to hold it for 10 seconds, come back to neutral, and wait 10 seconds before you do it again. But if that one's not enough for you, what you can do is take your right hand behind your back. If you're sitting in a chair, you can kind of hold onto the back of the chair. If you need help, you can hold it there with your left hand, or you can even cross your arms back behind you, as long as that doesn't hurt your shoulder, right? If it hurts your shoulder, then don't do this. But you can tuck that right hand behind your back. You're going to pull that shoulder down and back actively, so really engaging those scapular stabilizers. And then you're going to bring that left ear down towards that left shoulder. And this is a really good upper trap stretch. You should definitely be feeling this getting into those upper traps. Hold it for 10 seconds and return to neutral. Now again, one stretch is not better than another. It's what works for you. I give you some different progressions to make sure that you're getting an effective stretch, but I don't want you to feel like, oh, I need to get to that. It's not always better to do more. It's best to do what your body is asking for. If you do too much, that can actually increase your pain, and that may be why you have struggled to find videos or exercises that work really well for you, because they may actually be too intense. I understand the stuff I offer here on this channel is pretty gentle, but gentle can be super effective. You just might need to give it a little bit more time. All right. Which stretch did you like the best? What have you done to help your stiff neck? Drop a comment below and let us know what your favorite stretch was, or if you have any questions about this video or any questions about a stiff neck. We'd love to make a video to help you more. Also, click that like button. That always helps that algorithm. And don't forget to subscribe.